Hello, I'm Llewellyn King, the host of MECFS Alert. I'm delighted to welcome to the broadcast today Nina Muirhead, who is a surgeon, a dermatological surgeon in London, also an advocate for MECFS, and sadly, a patient as well. And she will tell us initially, I hope, about your suffering as an ME patient, how you contracted it, what your first reactions were in your early experience. And welcome, by the way.
Thank you ever so much for having me on MECFS Alert. I'm a big fan of the show. So I first got sick in September 2016 and had no idea what this disease actually is and how horrific it can be. And I was utterly shocked. To begin with, I thought I had a series of viral infections. It turned out that I had an Epstein-Barr virus, which was acutely reactivated. And I spent many months with flu-like symptoms, high temperatures, fevers, dizziness, difficulty concentrating, all the typical symptoms, but not realizing what was wrong with me. And I started adjusting my life to try and cope at work and looking after my children. So I wasn't overdoing it, I wasn't burned out, but I was getting increasingly sick to the point where I couldn't function, I could barely walk. And having had a background of enjoying running and cycling and being very active, I could tell there was something severely wrong. So I took a couple of weeks off work thinking that I'd get over the glandular fever, and I just got worse and worse. I ended up bedbound for more than 6 months, being cared for by 4 or 5 months of that time by my parents, who were nursing me, feeding me, getting me in and out of the bath, too unwell to live in the same house as my 2 young children and family. And eventually I returned home in a wheelchair, and I wasn't well then. You know, I still then spent more months in bed and having all the severe symptoms, hypersensitivity to light and sound, difficulty digesting my food, difficulty concentrating, holding a conversation, even reading or watching television was a challenge for me. So having experienced that horrendous side of the illness, and seen 13 different doctors to get my diagnosis and not even believed in the condition before I got sick, I was then on a mission to try and improve education, because most hospital doctors that I know don't understand this disease. I think there's greater awareness now because of long COVID, but there's still a long way to go. It's still often mislabeled as anxiety.
You're a doctor, and not only are you a doctor, you were educated at Oxford, so presumably you know all the upper tier doctors in England, the whole medical establishment, if you will, and yet you had to see 13 doctors to get a proper diagnosis. Most people in America, for what it's worth, tend to see 12 doctors. Horrendous thought that you're very ill and you've got to see a dozen or more doctors. How is your health today?
Well, I'm still not even half of normal capacity. I do struggle from recurrent problems with sore throats, brain fog, and I've learned the hard way how to pace. To begin with, I wanted to go back to work and quite quickly increase my hours, but in the end, it took me 6 months to go from sort of 2 hours a week to 6 hours a week, and then another few years to build up to double that. And I still have to really pace and choose very carefully what I do. I can't walk particularly far. I have a disabled badge. I still rely on my shopping being delivered, someone else to help me clean the house. You know, my functioning for someone who is normally fit and well is hugely debilitated. If I couldn't plan to go on holiday without wheelchair assistance or
What is your own reading of the onset? A lot of people I've talked to were athletic like yourself. They were doing something athletic. They came home, they felt they had the flu, and they've never been well since. And your story is obviously, as you know, not original, horrendous, but not original, alas. What was your own reading as a physician, as somebody in the medical field, going through this nightmare of doctors and this nightmare of not getting a diagnosis?
Well, to begin with, I thought I could just get myself better, like I had done after I had my appendix out. I had other pneumonia and other illnesses before, and I had exercised my way out of it and been better. I'm a really tough, stoic person, and I just thought I could do that. And actually, what happened was I was making myself worse. And it was quite clear that I was making myself worse in the days and weeks after trying to do a little bit more than I should, either exercise-wise or cognitively. I would have a huge relapse of all my multi-system symptoms. I'd feel flu-like again. I'd feel acutely unwell. So I realized that unlike my sort of pre-illness knowledge of the disease, this was quite different. This was nothing to do with being able to either imagine yourself better or exercise your way out of it. In fact, I sort of had a pre-notion that maybe it was to do with deconditioning and depression, and I was utterly shocked that it was the opposite. And the more I tried to recondition myself, the worse I was getting, which is why I ended up seeing so many doctors, because I read the UK NICE guidelines, which said cognitive behavioural therapy and graded exercise would get me better. And I thought, well, this isn't the disease I have, it doesn't fit. And it was only when I started speaking to other patients that I realised that actually this is a major health crisis that has been ignored by the medical profession.
After all these years and all the dispute about the NICE guidelines, we still hear of them. People are still prescribing exercise, graded exercise, which clearly is not the solution. We also get the feeling here that there is an institutional desire in British medicine to say that ME is anything except ME, that it's psychosomatic or that it can be cured with graded exercise, almost to avoid accepting that it is a full-blown and truly terrible disease. Is that correct?
Yes, and I think it's horrifying for the medical profession to consider it as a real disease, because it has major implications for policy and practice and how we go forwards. And I think we've really reached a fork in the road. The UK guidelines for NICE were actually due to come out next month, and they've been delayed now till August this year. And I strongly hope that that is because they're going to start taking on board some of the disease burden that we're now seeing with long COVID, and really starting to recognise there is a dire need to catch up with this disease, because there hasn't been a biomarker. It has been sidelined and dismissed. It's not been counted properly. It's not been diagnosed properly or recognised. And far too many people have had this illness blamed on personality or anxiety, and it's not. They have become sick and then they've felt anxious because they're being ignored, with a terrible, debilitating disease that has massively impacted their quality of life.
How much of your practice remains intact, if any?
So my day job, cutting out skin cancers, I'm lucky to be able to be back doing that. And whereas I used to work about 60 hours a week, as I said, I went back about 3 to 6 hours a week, which took me 6 months to work up to. And I'm now managing 3 half-day lists, which I spread across a whole week, just to be able to pace myself. But it's wonderful to be doing my normal job, and I can at least relax and do that, because I trained for sort of 15, 20 years to have that skill. and it's something that I can still do. I'm very fortunate. Very fortunate. I know that so many people don't get their careers back with this disease.
You made an effort to educate other doctors about ME. Tell us a little bit about that.
So as I lay in bed, realizing that many people are suffering with the exact same disease as I have, and most doctors aren't taught about it at medical school, I became increasingly determined that I should have a role to play. Before I'd got sick, I'd co-written a couple of medical textbooks. I love teaching and training juniors on the team. I love running workshops, and I'm a tutor at Cardiff University. So all of that fit very well with my desire to teach. And now I really have something to really teach the medical profession. And so I began, I took on a few medical students, even when I was really quite sick, supervised them in learning the patient narrative on the disease. And they did so well with talking to patients, and they really engaged with them. And I could see that the relationship was two-way. Patients did appreciate being taken seriously for once, having a brand new medical student who's quite naive to the ignorance of more senior physicians, and just listening to the patient and believing them for what they're saying and being compassionate. And the patients have a wealth of knowledge on this disease. We are one of the best educated patient groups there is. And I think it is a huge resource that we should use far more usefully to educate doctors and trainee doctors and all healthcare professionals. So I then hoped to do more with inviting patients in and doing a flipped classroom model where we introduce the information, the new biomedical and the existing patient narrative to the students, and then we bring in a patient and then they have a question and answer session and learn in that way, because there are very few specialists who can teach this across the medical schools worldwide, and certainly in the UK. Very few can really engage with what is being said at sort of the forefront of MECFS experts in the US Clinician Coalition and the Euromine group. So I wanted to really try and drive that forward, but then coronavirus hit, and so I put my energies instead to writing an online learning module. And I used 10 case examples, which are loosely based on real patient stories, to introduce the variety of symptoms with which people present, and to try and really tackle some of the common misconceptions around the disease.
Okay, well, that's extraordinary, and thank you very, very much. I'm wondering, what is going to be the impact of long haul? There are.
Well, I think it's going to get worse before it gets better. I think it's going to be huge. I think we're only.
But Nina, the question is a huge amount of money and political interest, and because of COVID-19 and long haul, will that in some way overwhelm the research that has gone on? Will the new researchers treat it as a zero-sum game and ignore what has been learned?
I hope not. I really hope that they can actually stand on the shoulders of their peers and learn from the MECFS research that's been done to date. Sadly, because of lack of funding, I think a lot of the studies have been quite small, but I think they should be built on, repeated, and we've now got a cohort of ideal candidates to really extend that research and find out more about the disease.
What is the work that is being done at Cardiff University? We teach Cardiff in Wales, of course, for people who don't know, but there you are.
So one of the things that we've been doing as a small group of researchers with a couple of patients is looking at the impact of MECFS on the quality of life of family members using a validated questionnaire on the quality of life of the family members that have been used with different other diseases. It was developed initially for dermatology conditions, but has been used with 25 other chronic diseases and cancer. And during a short pilot study, we showed that there was a significant impact on the quality of life of family members as well as patients. And so we've launched an international study, and that actually closes tomorrow, 31st of March. So we're hoping to get as many patients and their family members to complete that. It's the first study looking at the impact on quality of life of family members as well as patients. There's been a lot of research
which
showing,
of course introduces the question, what is the impact on the quality of life of your family, and particularly your children? How old are they?
So my children are now 5 and 9 years old, but I got sick when they were just 1.5 and 5 years old. So it has been a large proportion of their childhood. It's been a huge impact on them and on my husband, who had to take over a year off work to be my carer, on my parents, who were retired, fortunately, because they were also my carers for 6 months. And during all the holidays, they do a lot of caring and grandparent extra work compared to a normal family. So it's been huge, financial, emotional, it's extremely traumatizing to have such a sick family member.
What is your feeling about contagion? You said that you kept away from your children when you were first diagnosed because of fear of infecting them, I assume. Do you feel that in the early stages, as some doctors do, that the disease is contagious and and transmissible, and that stops after a while?
So that's a two-part question, because actually I stayed away from my children because I wasn't well enough to be in the house with young children. They cry and very loud, and I was really, really sick. Even just spending 20 minutes with them would put me in bed for a week. I was really that severe. I wasn't frightened that they'd get the coronavirus, the MECFS, but I do actually think there's a problem with MECFS patients giving blood. And obviously there's clearly some concerns there that there may be something that can be passed on through the blood or plasma. So I think it is a contraindication.
I ask this question because we've had examples where there have been outbreaks in this country at Inland Village and in Western New York State, and of course in the Royal Free Hospital in 1955 in England. If you have an outbreak, it suggests that there's transmission going on, or that there's some sort of environmental source. What are your feelings about that?
I think it's just the trigger that might be contagious, the initial infection. But I think the long-term MECFS that follows the infection has some genetic as well as environmental component to it. And it would be nice to look at epidemiology data that's coming from long COVID to maybe tease that apart a little bit better.
Your grandmother died at age 42, was it?
Yes, so she had several viral infections. We know she had adult chickenpox in her early 30s and a chest infection.
And she died of ME.
And yes, so we were very fortunate to have had 5 months of hospital notes from the 1950s, and my mum's own recollection of her mum's illness, which felt very close to home because she then witnessed me getting the same illness. So She had problems with dizziness, fatigue, all the post-exertional malaise. She even towards the end had fits from exhaustion, but it was fluctuating. So to begin with, she had neurological signs which were blamed on disseminated sclerosis, thought to be multiple sclerosis, but because it was fluctuating, there was a diagnosis of hysteria as well from the doctors, but she wasn't hysterical. She was terribly, terribly ill. She lost weight. She could barely digest her food. She had a sleep-wake reversal, and she ended up dying in a mental asylum with bed sores, terribly neglected, age 42.
And this was, of course, before you came on the scene. Could
Yes.
lend your expertise and just your company and assistance. That is a terrible story. Does it cause you to believe that the disease is generic, that it can be inherited, that it's transmissible in the family?
Yes, I'm sure there's a heritable component, and it's yet another reason why I'm determined to make more progress with education on this, because the ignorance that was seen in the 1950s is still being seen today.
We saw a young woman, terrible circumstance, who filmed her, and she had to be propped up in a wheelchair a few years ago. And her mother had it as well. So it was a mother-daughter. And of course, the normal human tragedy was huge because the father just couldn't cope. I mean, he had to work, he had to look after two sick women. It was really terrifying to enter their flat and see how they lived, which was just with a man overwhelmed, and two very sick people who needed enormous amount of care for the simplest things like getting a glass of water. Terrible to hear about your grandmother. And I'm so glad, though, that you're able to cast a light back and bring that knowledge forward to affect things today. I hope that it will bring about eventually a cure, but certainly immediately understanding. Seems to me that what you're saying is the need for understanding really precedes the need for a cure.
Yes. If doctors can't diagnose this and label it properly, how can we recruit to biomedical research properly?
Does the modern way of medicine with a lot of specialty make this more difficult? We see specialists, and I have the feeling that when you go to see a specialist, they say, we have a cure. Do you have a disease for us that will fit the cure that we offer or the therapy that we offer? And
I do think we need more generalists. And I know that the multi-organ sequelae of long COVID may bring some people who are more interested in patients as a whole, all their body systems taken into account.
That's fascinating, and you are fascinating. And it's an honor and a pleasure to have you on the broadcast. And I hope very, very much you'll come back, not once more, but often, and report on your progress and the progress of research in Britain, and how I'm very interested in what the church has called pastoral activity, which I think you touch on, with the impact on families. Who is looking after the sick when they cannot afford carers or they don't have family carers, which represents a terrible source of human suffering, to be that sick and to have no one to look after you. And that's a lot of concern to me and interests me how we can set up systems to look after the sick. Mm. So do come back and keep up your great work, and I hope you get better, and good luck raising your sounds delightful children. Thank you.
Thank you so much.